Haley Wansley is the chair-elect of the Oceanside Chamber, and she will be our moderator this morning. So Haley, I'm turning it over to you.
All right, thank you. As Scott said, I'm Haley Wansley. I'm with Intesa Communications Group, and we are a PR and government relations firm. And I live here up in Oceanside and handle North County clients. So I'm excited to be here with you guys today, and I cannot believe that we are here in the COVID update in September when we started this back in March. I feel like all the months are running together. So thank you all for being here today and joining us. First up, we'd like to introduce Supervisor Jim Desmond, who is the vice chair of the board this year and is no stranger to the chamber. I know that we've gone into his background before, but I will say congratulations on official retirement from being a Delta Airlines pilot. So thank you for being here today. I know you've been working hard to champion our businesses. So Supervisor Desmond, I will kick it over to you.
Well, thank you, Haley. Appreciate it. Yeah, right now, what I'm doing is I'm returning my ID card to Delta Airlines after 33 and a half years. Taking care of all that business. But thanks everyone for being here this morning. I'm actually in Oceanside this morning at North Coast Village here, just north of the pier. So enjoying life here at Oceanside. So COVID, and more COVID. Let's see. Let me get it before I get into that. The county we just did our budget. $6.4 billion. A third of it went to health and human services, a third of it to public safety, and a third to other programs. We just approved that budget. Also, we just went through, my office had $4.1 million to hand out in economic stimulus dollars that were CARES Act dollars. And I want to introduce, I would see Crystal Jabara is also on here. Crystal Jabara is from my office. If you have any questions, I have an 8:30 briefing, so I have to get off by then. But if you have any questions or comments after, or you want to get in touch with my office, get in touch with Crystal or call the office. But anyway, out of those CARES Act dollars that we had, like I said, 4.1 million, 700,000 of it had to go to restaurants. And we got $180 million in requests. And that's just in District 5 of North County, $180 million in requests for 4.1. So we divided it up as best we could. We had to spread it a little bit like peanut butter. So a lot of people that requested more money that it averaged about between $5,000 and $6,000 per entity is what we came up with, just trying to, because everybody was worthy in that allocation of money. So that was part of the budget, the CARES Act dollars. COVID, our numbers are still holding pretty well. We're still, decreasing. Our hospitalizations are fine. Only about 10% of the people in the hospitals right now are there for COVID. And we're only at about 65 to 70% capacity in hospitals. So we're doing well on that front. As you know, we all came off the watch list about a week and a half ago, and actually a couple weeks ago, and the schools are actually allowed to be open as of, I think it was Tuesday this week. So they're allowed to do in-school education. They're also allowed to do distance or some sort of a hybrid of that. And so schools have opened up. My daughter's a school teacher. She says it's like her first, she's been teaching that for 5 or 6 years. And she says it's like day one. She has to do everything new for the distance learning. So it's kind of a challenge. But so we got off the watch list. And then a week ago, last Friday, the governor came out with a new color-coded system for the state of California for when you can move to different stages and get things opened up. So most of you are probably aware, you keep an eye on this to see if you can be open or not. On Monday, barbershops, salons could be open to 100%. Restaurants can be open 25% indoors, so they can still have the outdoors, but they can be opened up to 25% indoors. I think churches can be up to 25% indoors or 100, whichever is more. I'm sorry, whichever is less. And gyms can be open at 10% indoors. So I didn't think it went far enough as far as getting things back to open again. The county actually put on an additional restriction, which task force and our health officer put in place, which I didn't agree with, but they didn't ask me. And that's where if you go into any of these new entities that opened up on Monday, you go indoors, like you go indoors to sit down at a restaurant, you now have to sign in with your name and a phone number. Same thing with the, if you go to a gym or you go to a salon or get your hair cut, you're supposed to get a name and a phone number. So on Twitter, there's been a lot of ingenious names that have come up to the people say they're going to use. But anyway, so that's the case right now with in the county. Now there's 4 different colors, yellow being the best, orange, red, and purple. We're in red. Basically, we're just staying pretty much where we were as far as the number of tests. We're testing about 225 people positive a day, which will keep us in the red. In order to get to orange, we have to be testing about 130 people positive a day, so about 100 less per day to get into the orange. And then orange allows those businesses that opened up at 25% to go to 50%. And then they have a yellow feature, a yellow color, which is the least restricted, but still has restrictions. And places like Legoland can't even open up in yellow, even though the zoo and safari park and SeaWorld are open. Yellow, you have to get down to 1 person in 100,000 per 100,000. So that means 33 people in San Diego County can test positive. That's it. And then, so it's even, my argument on that is, even if we had a vaccine and we were able to get 95 or 98% of the people to take the vaccine and get vaccinated, we would still never get to yellow. And there is no green. So there's nothing that, we can open up again. So unfortunately, I kind of see this as a keeping businesses closed option here with the new color-coded system. And it's frustrating. I remember about sometime back in May, there was, we had to have 0 deaths in 14 days over COVID, which was an unachievable goal. It finally went away. This one I'm hoping is, again, this yellow feature goes away that keeps businesses restricted from opening up. And, the mayors across the 78 corridor, including Peter Weiss, and we all sent a letter to the governor saying, hey, if a business can open and operate safely, they should be allowed to open. It's kind of picking winners and losers here is not the best effective way to do that. So that's kind of where we are with COVID right now. Our next board meeting is not until September 15th. So, I'm hoping to get some sort of movement or something that gives us a little more light at the end of the tunnel. It's we have to stay in each color system. Like in red, we have to stay, even if we make the numbers for orange, we have to stay in red for 21 days, so 3 weeks. So it's going to take 6 weeks in order to even get to yellow. And I know a lot of businesses are just kind of hanging on by a thread. So I wish I had better news. It is good news for the business that we're able to open, for the barbershops and salons and things like that. So, but I think the restrictions are still a little too onerous on business owners, and particularly members of the Chambers of Commerce. So I'll kind of stop my rant there. But I don't know, Crystal, am I forgetting anything?
No, sir. I think you covered it all.
All right. I don't know. Well, thank you. Thanks. And if you have any questions or comments or things like that, you can put them in chat. Crystal will get to them, or call my office. Be happy to help out. Thanks a lot for letting me go early and getting to my next briefing. Appreciate it.
Yeah, absolutely. Appreciate you being here. And that is a lot of grant requests. So well done. And thank you for spreading the love. And thank you for being here. Scott, was there any questions for Supervisor Desmond before we let him go?
Just one quickly regarding the restaurants. You may have addressed this as I stepped out of the room, so if you did, I'm sorry. But I know like some of the requirements for the restaurants, like the tracking of people visiting for indoor dining, yes, and the keeping on of masks, except when the meal is served. Oh, yeah. My understanding is those were add-ons by Dr. Wooten and were not required by the state. Is that correct? And
that's yes, that is correct. That the You're right. I forgot to mention that. If you're sitting down at a meal now, you have to keep your mask on unless you're eating. So keep that one last morsel on your plate and you can keep your mask off. But you're right. And the signing in and the rationale behind it, it was that, we want to keep the tracing and we want to, find people if they test positive, be able to trace it, and stop the spread of the disease, which I get, which is fine. But right now our tracing levels, after the demonstrations, they dipped down to below our trigger for being able to do the proper amount of tracing and getting to people within 24 hours after they test positive, as far as trying to find out who they were in contact with and things like that. We're at 96% right now. So the trigger's at 70%. So we're way above and beyond doing the tracing right now. And I thought it was a bit onerous. I understand the thought behind it, but it's almost more of a pain to go to a restaurant now than it was before. If you got to sign in, you got to wear your mask the whole time, except when you're eating. And so I believe we still have to tackle the virus. We still have to, beat COVID. We still have to do all those things and respect it. But we also have to have an economy so that we can, have the resources to do that. So I kind of see my job as balancing out that effort. But you're right, that was additional restrictions put on by San Diego County itself, and it was by our health officer. Basically, she signs off on all these things, so it kind of stops with her.
Thank you, Supervisor.
Yeah, and thank you for being here. So we will move on now. I think I saw the Congressman has joined us. So thank you, Congressman Mike Levin, for being here. I know we've introduced you and we know you very well, but you have been hosting town halls, introducing new legislation for our veterans, getting that legislation passed. So congratulations and thank you. And you've also been frequently flying back to DC to be there for very crucial, important votes to help our businesses and our economy. So thank you for being here today. And we would love to hear a federal update from you.
Well, thank you very much, Haley, and thank you to Scott and Bruce and everybody involved. One of these days, we're all going to be together as we used to be, but it is a very frustrating and challenging time for so many of us. And I'm on 24-hour notice right now. We can go back at any time. I think we're scheduled to go back on September 14th, and we've got a few more weeks in September of legislative session. Historically, the month before an election is usually not legislative session, and that is no different this year, at least as it currently stands. But in addition to getting the 5th COVID relief bill across the finish line, which is something that I think we desperately need to do for a variety of reasons that I'll discuss, we also have to fund the government. And so if we don't fund the government by the end of September, we risk another government shutdown. And that was a very, very bad thing before. When I started in the 116th Congress, we had the longest government shutdown in history. I saw the real toll that took on people, including in our district, and we must do all we can to avoid a shutdown at the end of the month. So no pressure on the federal government to get anything done, being facetious, of course. But I guess to put it in perspective, there is some encouraging news, which is that earlier today, in fact, just before I got on this Zoom, I saw a draft of the legislation, the COVID relief legislation that the Senate will be introducing. I think we're going to see it as soon as later today. That's important because it's very hard to negotiate against yourself. And we passed something called the HEROES Act in the House now, I think probably 106, 107 days ago. Very large, comprehensive bill, about a $3 trillion bill. And realistically, the Senate was not expected to support every piece of that bill. It was an offer that we made in the hopes that the Senate would provide a counteroffer. But then it took them a long time to provide that counteroffer. Through, May was the HEROES Act, so June, July, August, and here we are in September. Mitch McConnell and the Senate introduced something called the HEALS Act back, I want to say about close to a month ago now, but importantly, it did not have the votes to pass the Senate. It had maybe 15 or 20 Republican senators that said they wouldn't vote for it. So obviously it's important if you're trying to do a negotiation to actually have an offer, a counter offer, and hopefully to meet somewhere in the middle. And that's what we hope to do. And I know those discussions are going on. I'm disappointed whenever I hear or read that these discussions have become overly partisan. And look, the first, second, third, and fourth bills that we passed in March and in April, those were bipartisan bills. I think for all the negative that you hear about the partisanship and the polarization, let's recall that in March and April, the House and Senate got together and passed about $3 trillion in aid. And the other thing I will say, which hopefully is encouraging for you in the small business community, is there's no debate, no disagreement over whether or not we have more funding to help small businesses. I think the question is how we're going to do it and how much there's going to be. The Paycheck Protection Program funded over 20,000 loans. NCA 49, the number that I recall is $613 million in federal assistance that came through PPP. You also are probably aware that we funded that program to $670 billion. And the deadline, I believe, was August the 8th. When the deadline hit, there was $138 billion still sitting in the program, which tells me that we need to do a better job of making sure that money gets out to those businesses who need it the most. I was also frustrated with, as I'm sure many of you heard the stories of, some businesses that got money that really didn't need it, and then other businesses, particularly some of the mom and pop businesses that didn't get the money that desperately did. I hear from small business owners all the time in our community that want to see another round of funding. And you got to remember when we initially passed the Paycheck Protection Program back at the end of March, we were talking about 8 weeks as being the operative timeline where businesses would have to shutter for the COVID crisis. And it wound up, it's looking like it's going to be more like, in some cases, 8 months rather than 8 weeks, and there's obviously no precedent for what we're experiencing now. We just saw the unemployment numbers, I think 880,000 this week. And, the craziness about that is that is considered a good number. That's what we've, conditioned ourselves to think of as a good number. Prior to the COVID crisis, the highest number recently was 1982. I think it was 625,000 filing for unemployment in a week. And now we've had 23, I believe, weeks where we've had, 880,000 or more file for unemployment. So it's clear that we're not out of the woods by any stretch of the imagination. I have said all along and will continue to say that the way that we have a healthy economy is if we crush the virus and have healthy people. So we continue also to need to fund testing and embark on an ambitious strategy to deliver those tests to as many people as quickly as we can. One other thing that I'll mention is one of the big sticking points I see in the negotiating coming up in September is the funding for state and local government. You'll recall that in the CARES Act, which was passed at the end of March, there was $150 billion for state and local government. About 10% of that money came to the state of California. We went from a $21 billion surplus to a $54 billion deficit, seemingly overnight. And importantly, the $150 billion that we allocated in the CARES Act was specifically for COVID-related expenses. So in other words, you couldn't use it for things like revenue recovery. And that was particularly problematic because so much of the losses were due and continue to be due to things like tourism revenue down, transit occupancy taxes down, and so forth. So importantly, we're asking for flexibility for state and local, tribal, territorial assistance. Now, the bill that we passed in the House had almost $900 billion in that aid. And of that, $300 million would come to our district. Importantly, the CARES Act that we passed back in March did not allow any of the smaller cities, and I think I saw Peter Weiss on here, any of the smaller cities under 500,000 people to get any direct assistance. They had to get it as a pass-through the county. And we know that those smaller cities really desperately need more help. And particularly, things have gotten more challenging as time has gone on, not less challenging as time has gone on. So the HEROES Act, again, that we passed in May in the House, but has been languishing in the Senate, would include that $300 million. About $90 million, in fact, I think a little over $90 million would go to the city of Oceanside. So that would be a huge boost for the city of Oceanside. We're going to keep fighting for that state and local funding. I think it's critically important that we don't abandon our state and local governments, and we don't try to make this some sort of partisan thing, blue states versus red states. I mean, right now we see the virus spreading in places like Iowa and the Dakotas. This is, as I've said before, the virus doesn't care what political affiliation you have. The virus is going to do what it's going to do, and we just have to be ready for it. Another thing, obviously, we all care. I know I care. I've got an 8-year-old and a 6-year-old, my wife and I here. So if they Zoom bomb us here, they're on their Chromebooks right now trying to figure out their schoolwork here. We all care very much about schools reopening safely. And at 10 a.m. Today, we're hosting a day of action, virtual day of action for children to raise awareness of the need for resources to meet the demands for educating children in a safe and responsible manner during the COVID-19 pandemic. We've got a number of great speakers, the board president from the San Diego Unified School District. We've got teachers on there. We've got other superintendents. And if you're interested, we also have a nurse from Children's Hospital to talk about the health impacts of all this. So if you're interested, that's 10 a.m. We also have been doing virtual town halls. I think we're up to around 42 or 43 of those. We had one yesterday, and we're going to keep doing them. So I hope you can tune in across our social media platforms. Very briefly, you brought up veterans, and I wanted to make sure I brought up what has just happened with regard to veterans, as well as some of the environmental wins that we've had. We now have had 4 of our bills signed into law, 4 of the bills that our office has introduced for veterans. The most recent one is called the Ryan Cools and Paul Bene Specially Adapted Housing Act, and this is for our service-related disabilities, the specially adapted housing grants, and it really is a big breakthrough. We work very closely with Wounded Warrior Project and others on this bill, and it would increase the availability of resources for our disabled veterans to be able to adapt their houses, adapt their vehicles, and this is hopefully going to help a whole lot of people in our community. And it came after the direct input and feedback from veterans in our community, from our BSOs, Disabled American Veterans, and others. So I'm really proud of that work. We also have a lot of good stuff to talk about with regard to the environment. We have moved forward now with the $300 million for the Tijuana River Valley cleanup, which, if you do the research on it, it does impact even North County, San Diego, the air and water quality impacts of the cross-border pollution. And so the administrator of the US EPA was actually at the border yesterday, confirming, solidifying that the Tijuana River Valley pollution would finally be cleaned up with $300 million coming in from the federal government. That was truly a great bipartisan effort. I am very grateful to my congressional colleagues. Senator Feinstein was instrumental, and also Mayor Faulkner. We worked very closely together on this, and credit to all involved, and that's going to be a big win. We got money for the Del Mar Bluffs and the Lausanne Rail Corridor, $11.6 million for the Bluffs. We've gotten Army Corps money for the planning, engineering, and design for the Encinitas and Solana Beach shoreline protection. So we're always mindful of that. And then, of course, we've been working very hard on Santa Onofre and the issues there. And I'm grateful to those on this call. If you're at all interested, we've got a whole task force report. We're working very diligently to get that waste off our coast as quickly and as safely as we can. So I could get into a lot more. I hope that I have a lot more good news in the coming weeks, and that we fund the government because there are lives and livelihoods that are at stake, and we've got to get this done for the American people. Thanks again for having me.
Thank you for being here, and I hope we can fund the government as well.
Yeah.
I was in DC when a couple of those conversations are happening about the Tijuana River Valley and how important that is for us. Even in Oceanside, I know it feels like a world away sometimes at our border, but it is affecting our whole county and our waters. So thank you for advocating for that, for the bluffs, for our veterans. And
It does, Haley. All the studies from UCSD and Scripps Institution, they've actually looked at the modeling, and they've seen that the water flow does impact water quality in Oceanside, certainly throughout all of San Diego County. And the 300 million, we think we need around 400 million total. So hopefully the 300 million we can then leverage. And the administrator of the EPA being out there yesterday talking about that, which I think Supervisor Cox was out there and Mayor Faulkner, really good bipartisan win.
Yeah, great. Well, thank you. And Scott, was there any questions that went to you?
No, that's it.
Okay, I did see Kyle, your staffer, put the information for the 10 a.m. virtual town hall if anyone would like to join to learn more about schools. And again, Congressman Levin, really appreciate you being here. Thank you for taking
Thank you. If anybody needs anything federally related, contact our office. If we can't help, we will guide you to people who can. And I thank Kyle, who's rocking his beard. He's looking good with the quarantine beard. Appreciate him. And thank you all for having me as always.
Yes, he was complimented on his tan yesterday as well.
That's right. Well, hey, he lives right by the ocean. That's the Oceanside lifestyle, right?
Right. No excuses.
Thank you. Good to see you all.
Okay, and I think our Assemblymember Tasha Boerner Horvath has joined us. Is that right, Scott? Is she on the call?
Yes. Yes.
Okay.
Yes.
Perfect. Well, welcome, Assemblymember. It's so great to have you here. And Assemblymember Tasha Boerner Horvath includes Camp Pendleton, Oceanside, Vista, Carlsbad, and Encinitas. I know she's been working hard on some employment opportunities, some engagement with our community colleges on pilot programs, and also protecting our beaches and bluffs as well. So thank you for being here, and I will let you take it away.
Thank you so much. So Monday night, I think at 1:23, we wrapped up this year's session. It was a whirlwind. I wish as a freshman legislator, they would have told me I could take up I have a 2/3 vote bill, 1731. I'll talk about it a little more. I could take it up after midnight because technically we had to get all bills to the governor by midnight. But if you have an urgency clause on your bill, you could do it. So I was stressing out for 2 hours, like, is my bill going to come up? And it did, and it passed on a unanimous bipartisan, or almost unanimous. I think a couple people forgot to vote on it. But yeah, it was a really crazy year. But given the pandemic, I was so proud of me and my colleagues that we were able to pivot and really focus on COVID and economic recovery. So we managed to, it was, I shifted. I had 17 bills when we started before COVID hit, and we went down to 4 that focused on, or 5 that focused on economic recovery and COVID. And I'm happy to say that 4 of those bills made it to the governor's desk. One, which is really, really important, is probably arguably, like, on a very practical level, one of the biggest economic recovery bills that we have out there in California. It's AB 1731. Some of you remember this is my short-term vacation rental bill. Was not loved by the Oceanside Chamber of Commerce. Now it's 1731, my work share bill, and now you guys love it. So we redeemed it. So it's good to be able to do those things. And it helps, if you don't know our work share program, part of the bill will be to immediately start informing employers about what work share opportunities we have. And we will be working with iBank and GoBiz, and I'm sure we would love to partner with you in communicating to the people in 76 and in Oceanside about how they can, instead of laying off workers, they can reduce their hours. Those people's reduced hours are then compensated through federal unemployment insurance. So it saves in California's UI fund money, which ultimately down the road saves money for our businesses as well, and in the form of payroll taxes. And it makes it easier to open and close, right? And you can have to do minimum 40%, so you can't close completely. But think about a restaurant that goes from indoor dining to outdoor dining to curbside. They still need some staff that need to work some hours. And rather than laying off everybody and then having to rehire them and going through this back and forth and all that uncertainty, you could just reduce and increase hours. and it makes businesses, every country who's done this has been much more agile in recovering from economic downturns. So super excited about AB 1731, hoping the governor will sign it. We have AB 1949, which is our Carlsbad Fish Hatchery bill. This is a fun fact, the pro tem, our Speaker pro tem, Tony Atkins, her favorite bill of mine is this fish hatchery bill. Not clear why, but she said like, oh, she loves this bill. And this enhances sustainable sports fishing in Southern California. We have one of the only saltwater fish hatcheries on the entire West Coast. And so it's a really big deal, and we kind of fix their governance and improve the program so we can better use state funding that was available in the budget this year. We have AB 1927, which is a sexual assault witness amnesty, and it creates amnesty for victims of witnesses of sexual assault. Sorry, that's our train. We still need to, Kyle's on the call. Remember to tell Mike we need to have funding to help trench that guy. Creates amnesty for victims of witnesses of sexual assault and to encourage them to testify in court. You know, we've seen a rise in domestic violence and sexual assault during COVID-19. So it's really important that we provide justice to crime victims. So I think it's a really important bill, sponsored by Summer Stephan, our DA here in San Diego County, and got through on a bipartisan unanimous vote, is now on the governor's desk. And then the bill that usually makes me cry because so much work has gone into it for 2 decades. It's AB 1426, Saving Our Set. It's the Save Trestles bill. So people have been trying to save trestles for about, I think, 15, 20 years. And, you know, I had a mayor of Imperial Beach call me about it when he heard it got off the floor and was headed to the governor's desk. And he said, Tasha, for 15 years, legislators have told us why we can't save that park and save that beach. And you come in, and it was a 2-year battle, but in your first term in office, you saved one of the top 5 visited state parks in California and forever. And so that's super, super important, I think, for all of us and the next generation. So very proud of that work. Those 4 bills on the governor's desk. We will bring back our bills that didn't get through this cycle. We will bring back next year our small lot bill. It's a precondition for tiny homes and smaller lots. It's something I think that we could do to increase housing affordability here in North County without ruining community character. And we'll also bring back our telework bill. We had a bill with telework and it had too much opposition, so it didn't get through. But we will bring that back. And I want to thank you all, both the Oceanside Chamber, but all of the chambers in my district, for writing in letters of support for 1731. It's really nice to run a bill that had your support. And then I want to just highlight some other bigger programs of what we did. So, you know, I was on a task force working on economic stimulus, and we did a lot of support for small businesses. So we had my AB 1731 streamlining workshare. We expanded small business tax breaks, which it's almost impossible to expand tax breaks. So we did do it, and we extended the sales tax loan program. I'm very proud of that. I'm a co-author of that. We, in our budget this year, not everybody knows this, so I always like to point out, we excluded small businesses from increased unemployment insurance costs to repay federal unemployment insurance funds through the end of this year. I think that's really important. Sometimes when we talk about increasing unemployment, small businesses worry because they know in the last recession that caused a bump in their payroll taxes down the road. We have prevented that. We learned that lesson, and we've stopped that for this year. We've reduced the risk of small business owners and other Californians losing their homes due to bankruptcy. And we have, remember, I think we talked months ago about expanding our workforce training programs. Well, AB 14 and 57, which I was a co-author of, made it to the governor's desk. So we're really excited about that. That will help retrain people during, you know, because we're going to have some sectoral shifts during this economic downturn and pandemic. And so we're going to have the opportunity to retrain them through our community colleges. So super excited that is hitting the governor's desk. We hosted teletown halls with Insurance Commissioner Ricardo Lara to discuss his efforts to provide relief for small business owners. We partnered with the North County Small Business Development Center to provide a workshop for minority, women, and veteran-owned businesses on COVID-19 business relief. We've obviously slowed the spread. People are finally wearing masks, which is thank you for everybody for doing that. Our business is allowed to reopen. Our schools are allowed to reopen. I also, if you're interested, we did a teletown hall on school reopening a couple of weeks ago. Mike's obvious will be more federally related and talk about a little bit more about the current situation. Every school district is going to be different. I think the state's put in a more robust guidance for opening and closing and dealing with the pandemic that's going to last a little bit longer. But I want to thank you for all your input on all the things. Some of the things you wanted got through. Some of the things you didn't want got through. We could talk about that later. But now the legislature has adjourned for fall recess. I encourage everybody to reach out for my district office. We are again all still working virtually to protect public health. But we do use this time to be able to draft bills for next year. And so I'm happy to do listening sessions with the Oceanside Chamber or with any of your other groups to talk about what can we do to make our community stronger and more resilient during this very upcoming difficult time. You know, just to let you know, our office has been successful in helping a lot of self-employed folks resolve issues with their pandemic unemployment assistance. So it's not just bill ideas. If you know people who have EDD issues, if they have PUA issues, you can always contact my office. We have my field rep, Fernando Hernandez. He's not on this call today. He's on vacation, but I have Sulima Balderas here. They can always help with anything you need in my office. It's a pleasure and a joy serving you in Oceanside. And you know, if you have any questions, if we have time, I'm happy to take them. But I think I've covered a lot of issues, and usually I run out of time. But you know, definitely.
It's always very helpful to hear all the things that have been accomplished throughout the year, even as we're all, you know, struggling through a pandemic. But thank you for being here. And Scott, did any questions come in to you?
No questions. I just wanted to say congrats on 1731, and we were proud to be able to support that.
Yeah.
Yes, thank you. And it was so cool. Like I actually had bills where like all my chambers supported. Like that's not always the case, so that's really nice, you know. So I do appreciate that.
And I think your invitation to collaborate on future bills is always a really good reminder for chamber members and people on this call that we're all facing issues that you as a legislator need to know about, and that you're open to hearing them, and please reach out. So thank you for mentioning that.
Absolutely. And I would say, you know, what we could do is we could do these listening sessions, because the reality is there is so much we could still streamline. There's so much we can make easier. I think, you know, we didn't get through big bills on wildfires, broadband, and what was the other one? There are like 3 big issues that we wanted to work on that we just, the 3 houses couldn't, or the governor and the 2 houses couldn't come to an agreement on. So there will be something about broadband next year. There will be something more on wildfires next year. You know, there will have to be something, you know, on, and I'm working with our local police officers on, you know, how do we have some accountability in cases of extreme violence of law enforcement. You know, even our local guys have come to me and said, we want to get out the bad apples. So I think we have to be very nuanced and sensitive on how we do that. And so we'll be working with our local POAs and chiefs and the sheriff to, you know, how do we do that appropriately so we're not disincentivizing law enforcement. So there's a lot of big topics, I think, still out there for next year. We still have homelessness. We still have mental health. You know, we did some really great stuff on mental health parity too. SB 855, I think it was, or 885, I can't remember. So there's a lot of work we've done, and I think what we're going to do over the next couple of weeks is actually put out some more digestible pieces, because we've done so much and it all comes through at one time. It's not like Congress. They can do it piecemeal. So we'd be happy to share those with you and your members.
Well, thank you again for being here. We really appreciate it.
Thank you.
All right, and now to our locals, our mayor, Peter Weiss. He started with the city in 1986 as an engineer, worked his way up to be our city manager, and is now our appointed mayor, who is running for city council. I know he's not allowed to talk about candidacy on the job, but I would like to proudly say, as the chair-elect, and I know our chair, Debbie Allen, is here as well, this is the first year that the Chamber of Commerce is endorsing local candidates, and we're very proud to announce that Peter Weiss is our candidate choice for District 4. We know that he will do an incredible job once he's elected, and wish him the best in that endeavor. So thank you for being here. I know there's a lot happening on the local level. You're facing interactions with businesses every day personally and trying to work with the city manager and make sure things are really moving along. So Peter, if you wouldn't mind sharing with us what's happening at the city, we'd appreciate it.
Sure, thank you very much, and thank you for that endorsement. I would say just briefly, and I know probably most people on this call are aware that we do have a business loan program that is up and operating. There's still money available for businesses to apply. And we're also partnering with both the Chamber and Main Street on a business grant program that's you can apply both through Main Street for the downtown area and the Chamber for businesses outside of the core downtown area. We also have put in place a streamlined permit process for going outdoors, because we know even though there's people are slowly allowed to start going back indoors, I think the outdoor opportunities for all these businesses is going to continue. So we do have that process available. And we are also allowing additional encroachment for restaurants to go out into what would be parking areas outside their business. So for example, I know one of our restaurants downtown, they put together a design for a little parklet, and hopefully they're going to have that up and running here shortly. So some of those things are available because we foresee some of these restrictions, as you heard Supervisor Desmond mention, the timelines to go to now these different colored openings are so significant that we feel that the opportunities to get to some larger or less restrictive opportunities, I mean, we're looking at several months down the road. So we need to provide for these businesses to be up and running, for example, longer term. So we think it's important to try to get as many people back to work as possible. We do also have some resources available through our community resource centers, whether it's for rent assistance, whether it's mental health assistance, food assistance. We have significant food programs between the San Diego Food Bank here, serving seniors, and our kitchen collaborative. I think there are well over almost 300,000 meals served since the start of the pandemic. So it just shows that there is an ongoing need. And I think probably the biggest issue for me right now, the governor just signed an additional relief for rent and eviction cases. We've got a number, and we've heard from a number of, and I don't want to say the large apartment complexes, but the mom and pop landlords who are going to be on a path of not having any rental income for what could be almost a year. And I know in the governor's bill, they're providing some funding for them. But we tend to forget, we focus on just the small businesses, our restaurants and bars, but we tend to forget that there are a lot of these other business entities out there that are relying on income that are not going to be getting it. And we need to make sure that whatever we're doing at the state and federal level, it's not too little too late. We need to make sure not only are our restaurants and other small businesses, the hair salons and nail salons, being kept whole or made whole or being given the opportunity to stay in business, we need to look at all these other businesses as well. And I'm fearful that if this goes on too much longer without having some of these people get back to work or having to start paying some type of rent payment, that we're going to be seeing the economic devastation of this pandemic is going to be much more severe than the pandemic itself. You heard Supervisor Desmond say that they had applications for, I think he said $180 million. That's a significant amount of money of people needing assistance, and you can't provide it all. So how do we ensure that we don't have just a complete collapse of the economy? And we need to do whatever we can. And just like Supervisor Desmond said, in my opinion, any business that can meet the sanitation protocols and do all the right things should be allowed to open. We shouldn't just arbitrarily close one sector of the business community. For example, whether it's Legoland or our card room, if they can meet all the criteria, they should be allowed to open, and they're not being allowed to open. So with that, I think we need to do whatever we can, you know, the city in cooperation with the chamber and any other group that's out there, to push the issue to allow, whether it's at the county level through Dr. Wooten or the state level through the governor, to push for allowing these businesses to open. So if there's something we can do to help you, let us know, and we will certainly be willing to do it.
Great, thank you. Scott, I know that there has been some back and forth in the chat about the grant and loan program, and Michelle Geller, the Economic Development Director, did put in some resources, as well as Scott did, about our landing page for that. And the Chamber is happy to be a resource for anyone who needs help navigating that. But again, Mayor Weiss, I really appreciate all the efforts you're doing, and I appreciate you bringing up the part about evictions. I think that the Chamber can play a role there, and definitely work with their contacts and their membership to make sure that their voice is being heard, and collaborate with the city as well as the county supervisor. So yeah, with that, is there any other additional questions anybody has? Always feel free to unmute yourself too.
No other questions came in through the chat.
Mayor, did you have something else to add?
No, thank you very much.
All right, thank you for being here. I appreciate it. Okay, so now we are actually right on time, which is exciting, and we are going to switch gears to go into our hospital and health medical fields. We have a number of people, as well as education, to give us some updates on what's happening in our local hospitals. And first up, we're going to invite Jessica Shrader, who is also one of our board members, to present about Tri-City Medical Center. And Jessica is the Government Affairs and Community Engagement Manager for Tri-City, responsible for managing the relationships for more than 50 nonprofit community partners and addressing the health and social services needs of Tri-City Healthcare. She has more than 2 decades of experience serving at-risk communities in the education, social services, and healthcare sectors. And we appreciate her working with us as a chamber and leading our workforce development committee. And please give us an update on what's happening with our local hospital.
Thanks, Haley, for the introduction, and good morning, everybody, and I'll make this brief. Right now, just to report on our COVID patients, I'll give you a feel for where we're at. Currently, we have about 17 patients, and keep in mind we are a smaller hospital, so our numbers are going to be a lot smaller than you might see at other hospitals. But currently, we're about 17 patients. And in the past 30 days, we've had as low as 7, as high as 25. So we've kind of averaged out with about 13 patients. Total negative, out of all of our testing that we've done in our hospital, we've had a total negative of just over 6,135 total negative tests. That makes up about 96.4% of all testing that we've done within our hospital. Out of the testing, our positives were 226 patients positive, which makes up about 3.6%. We're good. We're in a good place with our PPE. I know that's a big discussion with hospitals in the community and all over the state to make sure that we are equipped with enough PPE and adequate PPE for our staff. And we continue to secure our PPE in preparation for any kind of surge that we might experience. We have really great connections with numerous partners in the community to make sure that we're staffed well with our PPE. So we are fortunate in that area. And that's pretty much the COVID update. I like to kind of balance it out with some positives because I know COVID is such a negative and we're always focused on that. And I think it's really good to keep in mind in life that we have some really great positives going on. And being that we're such a small community hospital, you know, we have made some great strides in certain areas. And recently, we were awarded recognition for having over 10 years of no PICC line infections in our NICU, which is unheard of. That is a great accomplishment for safety protocols. We were recently on the honor roll recognized for our maternity care because we have low rates of C-sections, episiotomies, and early elective deliveries. And we recently were awarded the five gold level awards with the guidelines from the American Heart Association for our heart and stroke care. So again, small community hospital, but big strides for care. And a little feel-good story I just want to leave you guys with. We recently had an ER physician retire after 45 years of service. And to put that into perspective, he is the only ER physician in the entire country to have served for 45 years. And upon his retirement, we acknowledged it, did a little celebration, and we found out that one of our own employees in our lab was brought to our hospital when she was 7 years old with a 105-degree fever. And her mom had been trying to figure out what's going on with her. You know, everyone's like, oh, it's just a fever, she'll be fine. Well, this physician, Dr. Karras, saw her and treated her, and she ended up having meningitis and saved her life. And now she's come back and she's been working at our hospital to run labs for him and other physicians to help save other people's lives. So such a feel-good story to see the tight-knit family and community that we have here in North County, and to see how our hospital and the community work together to help save lives and keep people healthy, and how it kind of like you see the circle of life come back, and people that were young and treated our hospital are now back working our hospital, helping to save other people's lives. So little feel-good story to leave everyone, and just remember, amongst all this negative COVID stuff and mental health and everything that everyone's struggling with financially, there are some good things happening out there. Thank you.
Thank you for sharing that. That's such an uplifting story. I saw all on the screen, all these nods and smiles and claps. So I think you uplifted a lot of spirits with that. So thank you. Is there any questions, Scott, that you've gotten for Tri-City?
No questions.
Okay.
Thank you, everyone.
Yeah,
Thanks,
thank you for being here. And I know that there's a couple of candidates for Tri-City Health Board on this call as well. So Gigi and Colleen, I see you. I don't know if there's others as well, but just wanted to give a quick shout out. And now we're going to transition to Scripps Health, who has just opened a new facility in Oceanside. It looks beautiful. And welcome Amber Ter-Vrugt, who is a personal friend and mentor of mine and highly respected in our community. So I'll give you a little bit of background on her bio. She joined the Scripps Health family in 2014 and serves as the Senior Director of Government Relations. She's responsible for educating elected officials and regulators on the unique issues facing Scripps Health, and represents Scripps with industry association, public issue groups, and regional business, civic, and community-based organizations. So prior to joining Scripps, Amber had been practicing public affairs and government relations for about 12 years and received an incredible accolade throughout her years, and was named the 2010 Woman of Distinction Award by Assemblymember Bill Emerson in the 63rd District. I'll tell you a fun fact after she's done that she shared with me that I thought was incredible, but I'll let her give an update on what Scripps is up to. Welcome.
Wow, that was quite an introduction. Thank you, Haley. So I appreciate everything that Jessica just said, because I think she's absolutely right. There's a lot of bright things going on amid some really challenging things with respect to the pandemic response. So I'll follow suit, Jessica, and share some exciting things as well. But I'll first give you a little bit of a rundown on the pandemic. And I know we've had lots of conversations in this group about our experiences and our numbers and things of that nature. So I won't spend too much time on that, except for to just say thank you so much for your support. I know Tri-City feels the same, and other hospitals as well. We really appreciate the chambers of commerce, all the businesses that, despite all of the hardship, really reached out to our employees and our frontline healthcare workers, because it's been hard times for them. And so again, really appreciate all of that. And I'll also just share, I know Sharp's not on the line, but between Sharp and Scripps, we've really cared for the vast majority of the COVID patients in the region. And so I would be remiss if I didn't just point out to everyone on the group that collaboration amongst all the hospitals has been unprecedented and just absolutely essential in the middle of this pandemic, and something that we're really proud of, that we've been able to come together both within our executive leadership teams, our leadership, our CEOs, but also within our medical teams, our medical officers, and folks like us. We're working together every day to make sure that we're on the same page and collaborating on some of the really challenging things around visitor restrictions and how are we handling testing and that sort of stuff. Also on supplies, you've heard from me before, our supply chain remains very challenged. Even just today, I heard that we've got some issues coming down the line with respect to our testing supplies. So there's just there's a lot of challenges that we still face, but we are working really well as a region, and I think it's something for the community to be really proud of, that the hospitals have really come together to do the best thing for our patients. The other question we've been getting a lot, we've been receiving a lot from the community, because nobody is able to be in the hospital, in the ICUs. People are asking about, what is it like? What is it like for your employees? What does it look like in there? So we actually put together a video to show what that's like, you know, what the PPE looks like. What we have some patients that have, you know, agreed to be as part of that. So it takes you sort of inside the ICU. So I'll post that in the chat if anybody's interested. But we did that because, like I said, we've been getting quite a few questions from folks in the community. And then, you know, I'll just run through some of the numbers just so you have them. I had a call earlier this morning with our physician leadership team. So as far as the virus is concerned, so right now we've hit 26 million cases globally, 6.1 million in the US, 722,000 in California, 39,000 in San Diego. We had 250 new cases yesterday, and we had 7 deaths yesterday. And, you know, it's interesting because we, as you remember, the last time we spoke, we were having some very challenging issues in the South Bay. I think a lot of that still persists today, but not to the degree that it was when last week we spoke about this issue. And right now, for the state of California, LA really has almost half of our cases for our state. So LA is significantly impacted at present. And as you heard from Supervisor Desmond and others, hospitals are in our region are really levelizing. We're seeing some extremely positive indicators. For Scripps, we are down to about 45, and don't quote me, I could have that number a little bit off, but we're at about 45 patients in the hospitals that are you know, COVID positive patients. And like I said, or maybe I didn't say, but we sent home 17 yesterday, which is huge. It's really exciting. So these patients tend to stay in the hospital a lot longer. So that was an exciting opportunity to get to send that many home. So at any rate, just sort of sharing with you where we are. There's also some more bright spots as far as where technology has gone during this time. And I think Jessica probably would totally agree with me on this one. All of us have been able to expand our digital capabilities during this time. And not that we never had plans to do that before. I think we were all doing a lot of that before as well. But as a result of the pandemic and the urgency of the situation, we are all now building out our telehealth capabilities, and our patients have really loved it. So there's a lot of that type of thing that I think are learnings from the pandemic that will continue in regular application. And then we also have a lot of learnings from the pandemic that will help us in future disaster response. And so I think all of those things are real positives. And I think I'll just leave you, I'm just trying to think if I had anything else in my notes I wanted to share with you. I'll just leave you too with some exciting news. As you mentioned, you know, we've got our new facility off Jefferson in the 78th that's going to be coming online very soon. I'm thrilled. I feel like it really turned out as beautiful as we had hoped, based on all of the design work and how the architects really took Scripps' mission and built that into the design with the, you know, transparency, the glass, all of the other elements. And so we're really proud of that. We'll have an urgent care and a ton of specialty care. So I anticipate that will be opening in October. Right now, we're much of the construction, as you can tell, is complete. So we're now moving in all of the new employees and all the equipment and all that sort of stuff. So I'm really excited about that. And then, as Jessica mentioned, a lot of the awards and accolades are coming in too, which is always nice because, you know, our teams are you know, our frontline healthcare workers, they're tired. This has been really challenging for them to deal with. And so it's nice to get those accolades. And so US News and World Report ranked Scripps #1 again. And we've got a lot of other just really exciting things happening. We initiated, and I'm going to get the name wrong. I should probably make sure I have it in front of me so I say it correctly. But we have the region's first centralized organ recovery center, which is a way to really help make sure that when you decide that you're going to be an organ donor, that there is a way for us to make sure that those organs get to people right away and that they're able to be utilized. There's some really interesting things that we have going on with glucose monitoring. And then again, we've gotten, you know, accolades with respect to our stroke care and and our other specialties. So again, thank you for the time today. More than happy to answer any questions that you have.
Yeah, we really appreciate both you and Tri-City being here. I think that just as our pillars in the community dealing with such a health crisis, you guys have been navigating it so gracefully. So thank you for that. And thanks for being here. And if anyone has any questions for either of them, feel free to put it in the chat. I believe they'll remain on the line, on the call. And maybe you guys could put a little bit of info on testing in there, like where you get tested or how you do that. I know that that's been some questions that I've heard in the community. So thank you for being here. Now we are going to switch gears for our education. I know there's been a lot of news recently, and I think every parent has an opinion about the way schools should open or when they open and etc. And another person who's navigating that so gracefully and listening and just not treading water, but literally just doing swan dives is Dr. Vitale. She's done an incredible job. And I would like to give a little bit of background on her as our superintendent of the Oceanside Unified School District. She earned her PhD in Urban Educational Administration and has taught for Concordia University since 2007. In 2015, she was named the Western Riverside County Association of School Managers Superintendent of the Year. And I would imagine that will be coming hopefully soon again for Oceanside Superintendent of the Year. She's done an incredible job. So I'd like to please welcome Dr. Vitale to give us an update on our K-12 Oceanside Unified School District.
Thank you, Haley. That's very appreciated. And you would be accurate when you say treading water and swan dives. As you all know, this has been a very challenging time. You know, we're all going through this on a personal level, and then we're all going through this on a professional level in whatever our role is. And as superintendent, as much of a privilege it is to serve this community, it has been a very challenging time. For all of us. And as you heard earlier, that officially schools can open September 1st. So what I'd like to share is a little bit about what we've been doing and what we really need in place in order to be able to open up safely. Through all of this, the guiding mantra for the Board of Education and for myself is safety. We've all read the news reports as other states and school districts throughout the country start to open up. They quickly have to shut down because of COVID outbreaks. And we are doing everything we can to not be one of those districts when we do open up larger than we have. So I want to share with you a little bit about what we've done. We have 16,242 students currently in 22 K-12 schools. We've been offering expanded enrichment since August 24th. So in essence, we are open. We're open to very small cohorts, and we're offering that service to parents in the community of students who are in a K-5 setting who need that. We're not calling it daycare because we're not daycare providers. We are learning providers, and we are working with our partners, the Boys and Girls Club and other organizations to provide this service. And that is growing daily as we get needs and requests. So we've been doing that safely now for a couple of weeks. We've handed out just over 10,500 devices. And this is important to know because that is the deficit of the devices. People don't have their personal devices at their homes. So remember, I said we had 16,242 students and we handed out 10,500 devices. And Oceanside Unified, just to be very honest, was not a district that had the infrastructure that it needed and the capability to actually meet the needs of 100% distance learning. But through a lot of magic and hustle, we've been able to provide the devices to all the students who need them. Earlier on the call, I can't remember if it was Congressman Levin, but or Assemblymember Horvath, they talked about connectivity. This is a real issue for our students. And we've had about 1,500 households request internet connectivity that we are going to provide at the cost of about $300,000. So when Congressman Levin talks about the money that is needed for schools, it is absolutely critical. As I talked about those 10,500 devices and said that this wasn't a district that had been building the infrastructure to prepare for a full distance learning kind of situation, many of those devices are already at the end of life and do not function with the needs that they're currently experiencing, with the amount of applications that people and kids and teachers need to use. So we're replacing all of those devices. So by the end of December, we hope, with the worldwide shortage of devices and the delay that everything is taking, all of our students and all of our staff will have new devices. That money is critical, and that's been provided by the federal government. So that will cost millions of dollars. Our connectivity will cost about $300,000. So that's what it's taking just to get kids connected. And Supervisor Desmond talked about his daughter that's a teacher and literally teaching in a completely different way. That is absolutely a fact. But on that front, I can tell you that, Haley, our teachers are doing swan dives and creating amazing lessons. I've seen them. We did give our teachers the opportunity to teach from our schools. So I've been in their classrooms to see what they're doing. And I've also been in their digital classrooms to see, and they are moving mountains to provide quality instruction to our students. Since March, we've served over 800,000 meals to the community. And that continues, as that is a very important service that we've been able to provide. And one special thing that I'm very proud that the district has been able to set up is we know that students are going to have struggles during this time, and many districts are providing online resources for tutoring and that kind of thing. We've actually hired 6 certificated teachers to provide online assistance to kids in the off hours. So they will work from about 1 in the afternoon till 7 at night, and you can have an individual tutoring session with them, or you can make an appointment with them. So if you're struggling in whatever subject it is, you can work with a certificated teacher to assist you with your classwork. And we've communicated about that and are very proud about that. We've also had an extensive parent academy, parents and guardians, so that they can learn how to use the technology and we can help them support their student. As we roll back and build upon our enrichment and begin to open our schools in a very measured way, there are a lot of safety precautions that we need to have in place. We have purchased, you may have heard of these, they're called electrostatic, if I'm saying that right, backpack sprayers, which basically provide the cleansing that we need when we have more kids in our schools. So that help keep our rooms clean and free of COVID, spending any time in any of our buildings. We've purchased hand washing stations. As we know, hand washing, social distancing, and masks are critical. And all of these things are on their way, right? There's just a lot of demand for these different items. We put plexiglass up in our offices, as well as providing every student and staff member with not only a cloth mask, but a personal plexiglass in the form of a face shield. And of course, signage will be everywhere. We have been working diligently to connect with students that have not yet connected with any issues they might be having. And we are providing social emotional supports as well as home visits to help students and families be successful. So with all of this, we'll be slow rolling into opening our schools. Nobody wants to rush into this. Some districts in the county have opened, and more will be opening as the coming weeks. And as we're able to provide the safe environments, we'll be doing the same thing. So that's an update, Haley. I hope I didn't go over my 5 minutes. I tried to be brief. There's just a lot of information to share. So I want to thank you for the time.
Yeah, and thank you for the time and making the time educate us. There is a lot going on. I think we read about it. We try to learn about it. I know I'm a part of the Boys and Girls Club, and we're talking about supplies and needing funding and all those things, and working hand in hand with you guys as the school district, and just so appreciative of your efforts. So thank you for being here. If anyone has any questions, please put it in the chat, as we're running a little bit low on time, but would like to transition to our higher education. We have Kristen Huyck with MiraCosta, and we also have Christine Lee with Cal State San Marcos. So hopefully they can both keep it down to 5 minutes, and we'll get out of here on time. But I'd like to give a little background on Kristen, who all of us probably know, but she is the Public and Government Relations at MiraCosta College, and she received her EDD in organizational leadership from Pepperdine. She's worked for MiraCosta since 2009 as a political science professor, and among other things. And we're lucky to have her not only on our board of directors here at the Chamber, but as an official property taxpayer in Oceanside as well. So Kristen, I'll kick it over to you.
Good morning. Thank you for allowing me to give a short update. Haley said to not tell the reason why I don't have my camera on. Some allergic reaction, so I have a Quasimodo thing going on. So I'm protecting everybody from this cartoon visual on my end. But quick update, I mean, put me after Dr. Vitale, like, whew, that's a hard one to follow. But I have to say, we have been collaborating with our high school districts, our feeder districts, and thank you to Principal and Dr. Villarreal over at Oceanside. I know he's been going door to door to students. I mean, talk about service. So the great work that's happening at OUSD is spectacular. MiraCosta, we are serving our students through a mainly online modality for the fall semester. Classes did start on the 24th. And so far we're up and running well. We have about 5% of our student body still coming to class for a hybrid model. So these are some of our automotive, or some of our nursing, and again, taking CDC recommendations, taking county guidelines to uphold social distancing in these classrooms. Great thing about automotive, it's the big shop class, so it's easier to social distance. So with MiraCosta College and just community colleges in general, we've been teaching online. So we did some fine tuning and some professional development for faculty, but really this is what we've been doing. So we were excited to be able to expand it out and to be able to continue the service and quality of the classes. A couple of things that are happening at MiraCosta, definitely we have the education side, but some of the collaborations with our community, and we're really excited about the Higher Local. And this is a collaboration with our TCI campus and the city of Oceanside. And it basically, the two teamed up that the city of Oceanside is providing for residents free, in-demand, kind of short-term vocational courses through MiraCosta's TCI. So this includes programs like our biomedical equipment technology, welding, computer numeric control, engineering technician. So this is that quick training. So we are really excited to see this program launched in July. So I look forward to be able to providing updates on the success of this program. A couple other things that relates to the community is we were able to get a renewal for $510,000 for our Southern California Veterans Business Outreach Center to continue to support businesses in our community with services they need. Another thing as it relates to the chamber and community is really the construction. Thank you to this group for the steadfast commitment in higher education and supporting the Measure MM bond that passed in 2016. So we have building going on this quarter of this year. We'll be completing a student services building at our San Alejo campus, as well as the track and field at the Oceanside campus, which the community largely uses. So we're excited to be able to have that open, as well as our community learning center, the campus on Mission Avenue, will be opening their will be finalizing the student services center in the first quarter of next year. And lastly, one of our new programs we're really excited to have from the great need and demand of the region is we now offer an associate degree for transfer in social work and human services. So we're seeing not only during the pandemic, but the need for additional social workers, a need for support in this area. So it's definitely a recession resilient career path. And so we are excited to be able to serve the community with this new area of study. And that is it for me. Keep it short and sweet.
Appreciate that. Thank you so much. And very important, and I think especially as unemployment rises and people need to transition careers, you guys are going to be a vital resource for them. So thank you for providing the update and being part of this today. Okay, last but not least, Christine Lee is the Community Outreach and Communications Liaison for Cal State San Marcos under the Office of the President. And she manages communication, publicity, marketing, and outreach initiatives. And it's an incredible asset to our team on the board as well. So Christine, with that, I will let you take it away.
Great, thank you so much, and I appreciate you giving me some time to give you some updates. Haley, earlier you mentioned testing, so I'd like to first off mention the COVID testing site. So last month, CSUSM became a host site for a free county-operated walk-in coronavirus testing center, and we were happy to provide this space. It was a win-win situation as we wanted to help the community and also have the opportunity for students and employees to have easy access to testing. So the testing center operates independently of Cal State San Marcos, is managed by the county, and it's located in our Viasat Engineering Pavilion. So it's open 7 days a week, 8:30 to 5. And there's free parking right next door in Lot F. And it's again, free testing, no copay required. And it's a first come, first served basis. So literally you just drive up. And to ensure safety, the safety and security of our campus community, this building was chosen because it runs along the edge of campus and it does not share a heating, ventilation, or air conditioning system with any other buildings or facilities on campus. And there's no in-person or hybrid courses occurring in that building. So in case you all need access to that testing site. As far as the academic semester goes, you know, our fall semester, as MiraCosta and Oceanside Unified mentioned, it looks and feels very different, but we're still excited to welcome students to help them earn a degree. Majority of Cal State San Marcos courses will be offered virtually, but we have 8% which will be offered in person. And these are mostly classes like kinesiology, nursing, and those that are hands-on, you know, and have learning modalities that just can't take place at home, or instrumentation that's required and can't be replicated at home except in a lab. So faculty have spent all summer retooling classes, preparing for students, and to help the community and the students and employees and parents get an understanding of what we're doing. We do have a website we launched called CSUSM as One. And it's a full service resource. So anyone who has questions about what's going on with us can log on to that website. Our final fall enrollment numbers are not available until October following our fall census, but we are anticipating over 16,000 students. We do know that we'll have fewer returning students than last year. We noticed that this trend started declining over summer. However, we expect more new students. Many are from out of the service region. And to prepare the students for this virtual environment, we actually provided an 8-week orientation program over summer to help support students. We have a ton of online virtual resources for students. They can chat with staff members on Microsoft Teams, which some of you may be using in your own businesses. We have a Cougar bot that's available 24/7. You can chat our Cougar bot and typically it will answer you how you need to be answered. Our IITS help desk has been nonstop busy, you know, assisting students with tech support, rentals. In March, when we went virtual, so last semester went virtual in March, we handed out about 1,000 pieces of equipment to support students with that transition. The other thing to note is we have transformed our ballroom. So if any of you have been to our USU ballroom for any events, that is now a computer lab. We have made it so students can access computers, printers, power, Wi-Fi from 10 to 4, Monday through Friday, first come, first serve. All they have to do is check the campus app and see if there's a computer available, and they have to come in wearing a mask. And each of the workstations are cleaned after each use. And so we're hoping that that works out for the students. The other difficulty is getting students engaged. So we have a ton of weeks of welcome events online. And as for housing, if anyone's curious, we have opened up our housing. We could typically hold over 1,500 students, but this semester we're anticipating about 250 students, and we can accommodate up to 600, so it'll be 1 student per bedroom and they'll have their own bathroom. So that is something that we have open. And just to conclude, I want to share that our Kellogg Library does have a COVID memory archive launch. So if anybody has memories or any experiences they want to, encapsulate, please let me know, and you can send it to our Kellogg library and they will take good care of that. And then last thing, Scott, in case if there's curiosity about budget, our total losses will be approximately $19 million for this academic year. That's inclusive of the state budget, auxiliaries such as housing, parking, cuts in enrollment, which are mostly out of state and international. I appreciate your time. I hope that was quick enough.
We got 5 minutes before the meeting ends, so we did it, which is awesome. Thank you to everyone who's contributed here today. I think these are so important for us to hear, and the Chamber, I know, will continue to work hard to make sure that we can meet the needs of those that need it most. So with that, I'll turn it back to you, Scott, and thanks for letting me join you all today.
Yeah, thank you, Haley. I just want to point out to everybody that there is some valuable information in the chat box. So over to the bottom, to the right of the Word file, you'll see 3 little dots. If you click that, it'll give you the opportunity to save the chat, and you'll keep all that valuable information. But Haley, you did an amazing job keeping us on time. You had 9 speakers, 4 of whom were elected officials, and you still kept us on time. So how about we all throw in a nice thumbs up for Haley there?
My palms are sweaty.
So our next Emerging Issues Forum will be on Thursday, October 1st. We will be sending out some information on that shortly, but I do thank you all for joining us. This video will be on our YouTube channel shortly, so you can share it with other people that you feel would be interested in this information. But thank you again, everybody, for joining us, and have a great day.